we have calcium disorder, the disease is called as calcium deficiency state, medically osteomalacia. When we say osteomalacia, we mean total deficiency or partial deficiency of calcium, which makes the bone brittle, and when bone becomes brittle, it has a tendency to break. Biggest and common example is even a trivial fall a person can sustain, and he can break the bone and sustain a fracture. Therefore, it becomes very essential for the treating doctor to understand this and talk to the patient when he is going to see him that please take care of your calcium status properly and well. This is what we mean by calcium disorder or osteomalacic disorder, meaning that the calcium status in the blood and the bone and the body is deficient. Need, having told the basic need of calcium for various functions, we can understand now lack of calcium can produce quite a few symptoms, which are otherwise called as quite a few symptoms. And what are they? The quite a few symptoms and complications and problems are patients having low calcium get tingling, numbness, and a peculiar sensation on the feet, on the fingers. This is one of the very early feature of calcium deficiency state, and this is something which a doctor in the periphery, or for that matter even a normal individual in the periphery, should be able to understand, appreciate, and once he sees that, his immediate role is to bring it to the attention of the attending doctor and say that this is something going on and it is possible the patient has got a calcium deficiency, please look after it. This is one of the common way in which persons with calcium deficiency present. The next way in which persons with calcium deficiency present is unexplainable bone pain, muscle pain, and inability to walk properly. And for no reason, a patient or an individual develops bone pain, muscle pain, one thinks of calcium deficiency state, refers the case to the doctor and corrects it if it is there. It is a very, very common problem in one's practice. Subsequently, calcium deficiency state or hypocalcemia, which we call it medically, can lead to some of the menstrual irregularities and problem in the genito-urinary system. And women having a problem concerning with the genito-urinary system should also keep in mind that this could be due to calcium deficiency state and be aware of it and take corrective measures accordingly. Thus, I have enumerated few fundamental ways in which calcium deficiency state can present in one's practice. Of course, we have already mentioned the role of calcium in bone maintenance, or otherwise called as bone homeostasis. And if the calcium deficiency is there, bone becomes painful, and if this is not treated, bone can become fractured, and once a bone fracture sets in, it is a long-term treatment, long-term problem.